lies on the teeth. Maintaining good dental health is something that is achieved through dedication and a bit of perseverance and effort. But, why is a healthy denture so important? Beyond the aesthetic aspect that determines a good smile, having teeth or gums sick, sore and bleeding makes life a little more tedious. Making chewing food is not something very pleasant. Here's some myths or legends invented by the abuel parents etc. Talc dental can be harmful. Some people still apply dental talcum, outdated, by hand. But the fingers do not reach all the areas of the mouth, and the powder could also be thick and erode the external dental layer. Use your fingers only to massage the gums after brushing. Dentures must be changed every 5 years. A good denture can last for many years, but not forever. The oral tissues of the lower part of the denture change over time, but the hard materials do not adapt. Hence, even perfectly fitting dentures should be changed at least every 5 years. Warm facial compresses do not mitigate toothache. The heat may aggravate the inflammation and increase the pain. If there is inflammation, the alternation of cold and hot cloths may help, but not for toothache. The inflammation should always be examined by a dentist, as it could be due to an abscess. Mouth rinses do not fight bacteria. Mouthwashes are essential in reducing the volume of the plaque, but do not reach the areas where there may be bacteria to which the brushes do arrive. Nor is it possible to eliminate bacteria by rinsing. Dr. Stemmer recommends brushing with a fluoride toothpaste before breakfast and using an oral elixir when finished. Fruit juice can harm dental health. Many parents give their children juice instead of carbonated drinks, but even if the nutritional content is better, their acidity could cause problems. The dentist Andre Hedger ensures that the juice contains a pH level above 5.5, level at which the teeth can dissolve. The sparkling water can dissolve the enamel. Avoid carbonated water, since it contains carbonic acid, which can dissolve tooth enamel. The ingestion of fluoridated water is linked to the reduction of cavities and the improvement of dental hygiene. Mouth ulcers are not usually a symptom of cancer. Mouth ulcers have multiple origins, but rarely cause cancer. It is possible that they come from hormonal changes, stress, lack of iron, folic acid or vitamin B12. They usually cure themselves in 15 days. However, it is advisable to review painless or non-healing ulcers, as they may suggest malignant tumors. Professional cleaning does not cause teeth to move. A cleaning of tartar can be quite invasive, but the teeth are well supported by the supporting tissues of the periodontium, including the bone. Bad teeth are not always hereditary. Although there is some genetic connection between parents with weak teeth and their children, it is more frequent that bad dental habits come from a bad diet established by parents. Fluoride is vital for children and adults. Fluoride is as effective in preventing caries in children as it is in adults. Always choose a toothpaste with fluoride, as it will strengthen your teeth against cavities. Dry mouth can damage the teeth. A constantly dry mouth is a sign of diabetes. If you do not treat this problem, the teeth can be damaged, since saliva is essential to drag the remains of food and neutralize acids. Flossing prevents heart disease. Flossing not only prevents diseases of the gums, but also those of the heart. American researchers have discovered that people with gum problems are twice as likely to have coronary problems. We can grind our teeth without realizing it. The action of grinding teeth is involuntary, and usually occurs during the night, when we are totally unaware of it. See your dentist for a night protector that relaxes your jaws. Baby teeth need as much care as adults do. While it is true that baby teeth fall, their early loss due to caries will interfere with chewing and affect the intake of nutrients. It could also lead to the displacement of adjacent teeth. As a result, the adult teeth may come out in an irregular position or in pairs. Do not neglect the importance of accustoming children to brush their teeth. Dental caries is not always painful. Pain is not always related to cavities. Only when there is an infection that cannot escape through the mouth, such as through a broken tooth, feels pain. It is very possible to suffer an abscess without realizing it. Hence, dental checkups at least every 6 months are essential. Caries can also attack adults. especially after age 60. Children are more affected by decay than adults, and the risk of this problem is reduced after 20 years. However, when adult gums reach 60, the risk increases again. Since the gums move away from the teeth, the roots are more exposed and it is possible that the caries attack. Dr. Phil Stemmer notes that the combination of refined sugars and bacteria can create cavities at any age. Milk can harm the teeth. While milk has an excellent nutritional content, it should only be taken during meals, since the content of lactose, milk sugar, can damage the teeth. For this reason, it is not advisable to leave a glass of milk on the bedside table during the night, because when drinking it the teeth will be exposed to acid attack, especially because the neutralizing agents of saliva dry out when we sleep. There is no damage to the teeth when the children suck their thumbs. Contrary to what is said, when children about 4 years old suck their thumbs, it is not likely that their teeth will be damaged. But if this habit continues, it could lead to the displacement of a tooth, which would prevent the proper development of it. Excessive brushing can damage gums and teeth. Once the plaque has been removed, prolonged and aggressive brushing can damage the teeth, because it damages the enamel and wears the tooth surface. Up to 20% of the population suffers from backing of the gums, often due to aggressive brushing. Dr. Stemmer suggests not to brush your teeth for more than 2 minutes with rotating motion. It is preferable that you place the brush on the neck of the tooth, where it joins the gum, and make small movements at 45-degree angles. Dental whiteners do not change the color. Whitening toothpastes only remove stains on the teeth, which makes the original color, white or yellow, stand out more. But they will not make the color of your teeth look whiter or brighter. Do not ignore mild toothache, it will only make it worse. Most toothaches start mildly and gradually worsen. Do not ignore painful stings, pressure or other signs, however weak they may be. Go to the dentist if you feel pain. Chewing gum can help prevent cavities. Sugar-free gum helps prevent tooth decay by removing bacteria from the teeth. They also facilitate the production of saliva, which contains calcium and phosphate. This kind of dental wash remineralizes and hardens the teeth after the acid attack of food. Choose a type of chewing gum that contains xylitol, a natural sweetener from pine bark that reduces harmful oral bacteria. Sucking an aspirin does not eliminate toothache. If you have a toothache, an aspirin may help, but only if you swallow it. The direct application of the tablet on the painful tooth can burn the soft and sensitive tissues of your mouth. Pregnant women should take care of their teeth deeply. Pregnant women should be very careful about dental hygiene, as they are more likely to eat more sweet foods and more often. In addition, they can suffer bleeding in the gums due to hormonal changes. Mouthwash products with alcohol create bad breath. Some researchers claim that alcohol-based oral elixirs feed bacteria and bad breath. They can also dry their mouths. Certain studies link high levels of alcohol in the mouth with oral cancer. Saliva shows if we have bad breath. Put some saliva from the back of the tongue on the inside of the wrist. Let dry 1 minute and check the smell. Brushing is good for bleeding gums. Bleeding from the gums is a sign of poor health and inflammation, usually due to an accumulation of plaque around the teeth. The gums will continue to bleed until the plaque is eliminated, so that brushing helps in the recovery of the gums effectively. Brushing after meals can do more harm than good. Although it is important to brush your teeth in the morning and at night, it is not necessary to do it after every meal. In fact, this practice can be more harmful than beneficial, especially after the ingestion of acidic foods such as citrus fruits, since brushing would eliminate enamel weakened by acid. Postpone brushing at least 1 hour after the meal. It is also better to wash your teeth before breakfast, not later, as this prevents tooth erosion by covering the teeth with fluoride. White teeth are not as strong as yellow teeth. The nuclear target is more attractive, but research shows that these neat teeth are less resistant to decay than yellow teeth. As we grow older, the structural changes in the dentition, the semiosseous tissue beneath the enamel on the tooth surface, and the reduction of the blood supply to the teeth can make them look more yellow, but not it less healthy. The excessive use of bleaching products can also eliminate the protective enamel layer. An electric toothbrush is 3 times better than a manual toothbrush. Manual brushes are often used in lateral movements, which can wear the gums and the neck of the tooth. Electric brushes are better because they vibrate in 3 directions, which means they clean in greater depth. Should combine with use of dental thread. It depends also since they are the same in normal conditions, but if they are more useful in people with disabilities and those that have to be brushed by a third person. Chocolate protects against cavities. If you want something sweet, it is better to take chocolate instead of sticky candy. The Japanese researchers found out that the part of the cocoa bean from which the chocolate is extracted has antibacterial contents that could prevent the appearance of cavities. While sugar in the mouth increases the risk of the problem, this component could compensate for the high level of sugars in chocolate. Chocolate can prevent cavities, only if it is pure. When you add sugar and if it is cariogenic. Brushing and flossing do not eliminate bad breath. The use of the brush and floss regularly removes excess bacteria that remain trapped in the mouth and produce bad breath, says dental surgeon Philip Stemmer, of the Good Breath Centre, in London. But there are other causes that can cause halitosis, such as the ingestion of sulfur-producing foods, such as onions, or the dry mouth that certain medications cause. The buildup of bacteria on the back of the tongue also aggravates the problem.